It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Thanks for joining us, my friends. I know these are trying times, and I'm hoping that all of you are well and are staying healthy. So what we'd like to do today, I'd like to continue on trying to provide you with as much information as we possibly can. You know, we are running the LVHN shows Monday through Friday, information on the coronavirus and a number of things. So we're just inundated with information, but I think sometimes the more information we could have, the healthier we could be. I have on the phone via Facebook Live Phil Benyo. Phil Benyo is a PA, practicing physician for over 18 years. You know him. You see him every day on It's Your Health on the SSP TV system. And we'll talk a little bit about some things that you should be doing. And probably a trend that's happening now is telemedicine, etc. Phil, thanks for coming on the show.
Thank you for inviting me. I'm glad to be here to give you some more information.
All right, Phil. Well, you know, we talked about a number of things, or we're reading about a number of things, but now let's talk about allergies, all right? Because the seasonal allergies and how this is going to blend in, and if people have allergies thinking they have corona, etc. So let's give us the audience an opportunity of knowing what they should be looking for with the allergies right now.
That's a great question, because this is the time of year we certainly see allergies. The good thing about allergies is most people have already had them before, and they kind of know their symptoms. And had it not been for this whole coronavirus thing, some of the symptoms you'd be having from allergies, you'd probably just chalk up to allergies and ignore. But because of what's going on, we get a lot more excited. And so when I think of allergies, I think of itchy watery eyes, an itchy nose that's running, maybe some postnasal drip, sometimes a scratchy throat. You can occasionally develop some coughing as well. But allergies, typically, you're not going to see a fever with. You're not going to have pain with. You're not going to have what's called purulent discharge, like yellow or green mucus coming from your nose or coughing it up. And you're not going to have a whole body reaction where you have muscle aches and pains that you would typically see in another type of infectious or viral type episode.
But let's go into the symptoms of the flu now.
Well, the flu is kind of a, you know, we always say if you haven't had the flu, you almost don't know the symptoms, but if you've had it once, you'll never forget. It's kind of a full body reaction. You know, it's typically muscle aches and pains. Your muscles are sore, like you ran a marathon, but you didn't do anything. It's a very sudden onset. You know, you don't start getting the flu for a few days. You wake up in the morning and by 4 o'clock you feel you got hit by a truck. You'll have a cough that's typically loose or non-productive. It can be harsh. You can have a headache. A headache is usually quite prominent with the flu or influenza. You're not going to have any particular sinus congestion or ear pain or pressure. It's kind of just a whole body reaction, and typically, you know, for me, I really don't think about the flu unless you have a fever, you know, and if you don't have a fever, you really don't have the flu in my book, unless you're on some medications that would suppress fever, like you're taking Tylenol or Advil routinely, say for knee pain, that would suppress a fever. I would expect a fever in someone that has the flu. Typically, the flu is also not a GI related infection or inflammation. You're not having diarrhea or nausea. That's more of a GI bug, which we also see at this time of year.
If they have allergies or if they have these flu type symptoms, should they call the doctor? Should they go to the emergency room? What should they do?
Well, I really think the emergency room should be for emergencies. And so if you're having chest pain, if you're having difficulty breathing, if you're having belly pain that is just a 10 out of 10, that's what the emergency room is for. Otherwise, going to the emergency room for something like sinus headache or postnasal drip or allergies is really going to not only overwhelm the emergency room services, but it's also going to expose you to a lot of illnesses, because the people in the emergency room are sick. There's a lot of different things you can do before you need to get to the emergency room.
Okay, so let's talk about what you and I are doing right now before we get into the coronavirus, and you know what are some of the areas there of concern. What you are doing now, what are you doing now, your dad, Dr. Benyo, and other doctors, in terms of video conferences or phone calls? What are you doing now?
So Lehigh Valley has, since the coronavirus has kind of taken over the area and the country, is Lehigh Valley has instituted a policy where virtually no one is coming into the office for an appointment. So medicine as we know it is, you feel like you have a cold or a cough and you want to come down and see, you call, you make an appointment. In our office, you just show up. A lot of people do. And we check you out and we examine you. And they found that really having everybody interact like that, sit in a waiting room for 20, sometimes 30 minutes with other people who might be sick, really is a way to just spread illness. And so Lehigh Valley's done their part by saying we're not going to allow people to do that. And so they've shut down the offices so that we're not really seeing patients in person. Now, it's not like we're abandoning healthcare. In fact, we're more accessible than ever. Now what we do, instead of seeing patients in person, which, by the way, if you need to be seen in person, we do that, but we're not doing it at all different offices all over Hazleton. We've kind of, centralized that care so we minimize staff contamination and patient contamination as well. Now we're doing phone visits. So you call and say, I'm having a problem, I want to speak to my doctor or PA. They put you on my schedule. Usually within a few minutes, you have a scheduled time that I call you and we talk over your symptoms and review everything. And if it's something that we can work out over the phone, and it's, say, allergies, I can call in or send in some medication for your allergies. If it's you need having blood pressure issues, that's something that we can typically take care of over the phone. Let's say that it's something you can't take over the phone. It's something I have to see. You have a rash, or maybe you have a wound or something that's infected, but you really still don't want to come out of your house, and we need to take a look at this. Lehigh Valley now has video visits, and they're very much exactly what we're doing right now. So instead of talking to me on the phone, you with your smartphone are able to use the LVHN app that you can download, and you can connect with one of us through a scheduled video visit where we talk it over and review everything, and then we also get to look at things. If you have a rash, I can look at that. If you have a wound that I need to look at, we can accomplish that over the phone. And the video quality on these phones is nothing short of amazing. So we're able to accomplish quite a bit without having that person-to-person interaction, which is still very important to what we do. But during this time, we have to limit that so we're not spreading more illness, because this is a rather contagious disease we're dealing with.
Do you feel that's quite effective, with the phone teleconferencing back and forth, talking to you? Because you can't check my blood pressure, you can't listen to my heart. What are some of the alternatives that we could be doing if we're not feeling well and we're talking to Phil Benyo Jr. on the phone?
Well, some people do have a way to get their pressure checked at home. They may have a machine that they already own, and a lot of people who have high blood pressure usually they'll have access to some type of way to check. If it's something that cannot be handled over the phone or over the video, we still will bring patients in and see them. We still are, our main office or central office that we're working out of, the Desson Center, still sees patients as needed, and it's determined by us to say, this is someone I really need to see. And if that's the case, we schedule them to come down. Now, it's not like a normal office visit. You have to wait in your car till staff comes out and gets you. There's no waiting in a waiting room, so you're not interacting with anybody else. You're brought right back to your room. It's almost like a concierge type service. Your blood pressure's checked. You're checked in just the way any appointment you've ever had with us, and then we come in and see you, and we evaluate everything. If we need to listen to your heart, we need to listen to your lungs. We're monitoring blood pressure. Whatever we need to do can certainly be accomplished in person. Something like taking out sutures or staples, we can't do that over the phone. That you got to come in for. If you're having some type of difficulty breathing, but I know that you have a heart problem that could be causing it, that's something we can see. For people who are sick with flu-like or COVID-like illnesses, we're trying to really keep them sequestered as much as we can by evaluating them over the phone and sending them to a test center to be tested and quarantined up until we get those results.
Well, that's interesting. Now I'm going to come back after break and talk a little bit more specifically about the COVID-19 and some of the things. Now, before we go to break, okay, what are some of the major symptoms of COVID-19, Phil?
Well, I think that's, I think when you think flu, you want to think COVID. The difference is that I think COVID and what we're seeing as it's starting to evolve in our area is we're seeing some more, really difficulty breathing accompanied with that fever is something that's very obvious because this really does attack the lungs. Unlike the flu, which is more of a full body issue, the COVID virus seems to really cause a lot of inflammation and infection and targeting the lungs, and that's how it enters our bodies through our lungs. Specifically, there's receptors there. And so cough, heavy chest congestion, difficulty breathing, wheezing, accompanied with some of that flu-like illness. But we're also seeing this subsect of people who it starts off as diarrhea and then morphs into some cough and chest congestion and difficulty breathing.
Okay, now at that particular, folks, we're going to come back. Here's what happens. If you are having some of these symptoms, do you panic? There are certain things that the Lehigh Valley Health Network has set up in the screenings, free screenings. There's an e-visit and et cetera. We're going to discuss about some of the things that you should be downloading and be able to help you with that. And once again, it's information I think you really need to know. We'll be back right after this.
The American Red Cross urgently needs blood and platelet donations and asks all healthy donors to schedule an appointment to give now. With the coronavirus outbreak, it is important to maintain a sufficient blood supply. Your blood donation is critical and can help save lives. Please schedule an appointment today. Download the Blood Donor app, visit redcrossblood.org, or call 1-800-RED-CROSS today. You can make a difference.
Welcome back to the Sam Lesante Show, folks. Remember, 24/7, go to our website, ssptv.com. No more of the apps because you'll get all of the information in detail on our web. Very easy to get on our website. Very easy to get to it. I'm talking to Phil Benyo Jr., physician's assistant. He's been doing it for almost 18 years. We're talking about the COVID-19 and some of the things that you should be doing and recognizing. Phil, again, just for a repeat, in terms of symptoms for the COVID-19, what are they?
Well, it's very flu-like, but I think the caveat is there's more lower respiratory tree inflammation or infection. So cough, shortness of breath, wheezing, fever, very flu-like in that regard. Body aches. I think that some of the differentiations between this and the flu are the lower respiratory. This really attacks us through the lungs, and that's where we get the first inflammation. There's a subset of people we're seeing that really their first symptom is diarrhea, and then it's morphs into cough, shortness of breath, wheezing, heavy kind of lower chest congestion.
Lehigh Valley Health Network set up 3 different free COVID pre-screening options. Okay, so let's talk about those options as to what the viewers should be doing now so they can have the free screening. And it says here, in the comfort of your own home. Okay,
Right.
Okay, so let's talk about those.
So what they've instituted, and I have to give them credit, they were able to pull this off very quickly, is that let's say you're concerned and you want to ask questions, and it's a Saturday or it's a Tuesday, or it doesn't matter what time of the day. You can go to mylvhn.org or you can go to the app, the mylvhn.app. But if you don't have the app, you can just go to their website and you can select from a couple of different chief complaints or problems, and you're filling out a questionnaire. And it's a questionnaire that's really based to decide whether or not you may have COVID. Now, the app itself for the website does not determine whether you have that. That gets sent then to a pool of physicians, physician assistants, and nurse practitioners that are reviewing those real time. And they're sent to our computers all day and all night. And we take a look at those symptoms. And based on those symptoms, sometimes we'll ask some additional questions. Sometimes we'll pick up the phone and call you. Sometimes just based on your symptoms and story, we will order testing. And so let's say you have, you've had some low-grade fevers, you've been short of breath and having a cough, and it's been going on for a few days. Add on top of it, one of your friends at work just tested positive. Based on that story, I'm going to send you for testing. I don't need to see you to do that. I don't have to send you to an ER or an express care. I will order the testing through the computer, and I'll send you a list of 10 different areas in the Lehigh Valley Network, of which there's 2 in our area, that you just show up at their door, tell them you had an online encounter, and they will pull up the order and they will do the test. And they'll also then give you the results of the test. Now, the tests aren't coming back right away. We're getting better and better at getting them faster. It was taking up to 10 days, and we're hoping with some of the newer technology coming online, we'll have testing within just a few days resulted. The other option is you can say, well, geez, I really want to look at someone face to face. I want to do a video visit. You can do the same thing by going to the website, and then you're going to download the app. You know, the My LVHN app is something that it's a free app to download. You do not have to be part of the LVHN network to do that. And then you're able to sign up for a video visit. And let's say tonight at 6 o'clock you have a question, you're really concerned and worried, and it's after hours. You can log on to that app, go to the video visit, and request one. And usually within 5 to 10 minutes, usually less, a physician assistant, or nurse practitioner will show up on your screen, and they will talk over your symptoms and your concerns. And if he needs to order testing, or she needs to get order testing, they will, and they will arrange for that. If it's just reassurance or something else needs to be done, you'll get that as well. And there's a pool of people that are signed up to be available to do these visits. So I sign up for a certain time frame where I'm just doing these visits. My brother, my father, the same thing. We sign up to do these. And there's, you know, over 1,000 different providers across our network that are signing up to do these. So we can really try to get things done and ready real time.
So now, Phil, if I go and I'm tested, all right, and I'm positive, okay, that I have corona, what happens?
Well, really what happens is you need to quarantine for 14 days.
Now, why 14 days?
Because that's the time frame that they feel it takes this infection or virus to clear. And they want to see you, you know, right now we're not doing testing to be sure that it's cleared. In the hospital, they're sometimes doing that. At this point, in an outpatient setting, so you're not sick enough to come into the hospital, there is no treatment other than, you know, rest, some Tylenol for fever, the aches and pains, and time. If you have a history of asthma and you have an inhaler, you might need your inhaler. If you get sick enough to the point where you're having some significant trouble breathing, and then you have to be admitted to the hospital, then the treatment's different. But in the outpatient setting, unfortunately at this time, this virus is so new to us, we don't have a treatment for it. And remember, this is in the same class of infections as the common cold. You know, literally is the same class. The difference is it's more deadly. And it's just as contagious. And so there is no cure for the common cold. Likewise, there is no cure for this right now. Mind you, they're trying to come up with ways to cure this common cold, but we're not there yet.
What are the degrees here in terms of when you say death, okay? And that scares everybody because, you know, if someone has coronavirus, you know, the fear is I'm going to die, all right? And I had a person from China I interviewed, and the percentages there, even though in his area were low, but some areas were high. Okay, so what are the degrees here that you know that you're in really serious situation? I know there's no easy out here, but I mean to soften the worry and people who actually have coronavirus.
Well, I've talked to people that have tested positive, and actually the only good thing about the test taking so long to get back, initially the tests were taking 7 to 10 days, is, you know, we call these people 10 days later and say, oh, by the way, you're positive. And the first thing out of their mouth is like, oh, I'm surprised. I feel a lot better. You know, I don't have a fever anymore. I'm kind of over it. I'm surprised I'm positive. I thought I'd be sicker. And so we're seeing the gamut. You know, we're seeing people who are surprised that they were positive. We're seeing people who are sick and feel like they had the flu for 10 days. And then we're seeing people who are very sick requiring hospitalization. I think as we see it more and more and we test more and more and we find out more and more people are positive, and in our area we're seeing if we test 100 people, at least 10 of them are positive. That's the percentage positive rate of testing. And we're doing a fair amount of testing here in town now that we have 2 test sites. But a lot of people it's very mild symptoms, and we're not testing people who are not symptomatic. So for instance, if you said, someone here at work tested positive and I was around them for a few hours at lunch on Friday, I'm really worried, I want to get tested. That test, we're not using that test for someone who's not symptomatic. We'll tell you, you really should quarantine and, do social distancing, do hand washing. That's the most important thing. But we're not going to test asymptomatic individuals, which kind of leads you down the road. Are all these people, are there some positive people out there that had just a sniffle? Maybe, but we're not testing them, so we don't know. We're kind of, at least in the United States, we weighted our testing for the most severe cases, and that of course showed a higher fatality rate because they were sicker. And now that we're testing more broadly and it's more acceptable and easier to access, I think you're going to see those mortality rates go down. But I wouldn't lull that into a sense of I shouldn't be worried about this, because this is, again, a highly contagious illness that does kill people. And it may not kill you, but it may kill someone that you talk to or one of your loved ones. And that's how you have to realize too, is that it's not necessarily about how it's going to affect me perhaps, but it may affect my father, for instance, or some other patient I may see.
Folks, I'm talking to Phil Benyo Jr. Is a physician's assistant. He's been there doing it for over 18 years, and you can see him every day on It's Your Health, very popular show with his father, Phil Benyo Sr., and his brother, Dr. Daniel Benyo. We come back, we'll talk about prevention. How do we prevent some of these things and learn a little bit more about this terrible, terrible thing, the coronavirus. Stay with us.
It's the power of localism. Larger media companies don't have the pulse on what drives the country right now. They don't understand what's driving the concerns in the American communities, but you can get that through SSP TV because this is a platform for community engagement.
Welcome back to the Sam Lesante Show, folks. There's things you should remember. Create an e-visit with the Lehigh Valley Health Network, mylvhn.org or mylvhn.app. The hotline, if you have any questions, is 1-888-402-LVHN. On the phone right now via Facebook, Phil Benyo Jr., a physician's assistant for over 18 years. We're talking about prevention as much as we can. What should we do?
Well, I think that, the best thing you could do is do what we're doing now. Is normally if we were doing this show, I'd come into your studio, we'd shake hands, I'd say hello to everybody, maybe a hug. That's the last thing we should be doing. So the social distancing is the most important thing. Ask yourself, if you need to go out somewhere, do I need to do this now? Is this vitally important? If the answer is no, you probably shouldn't be there. Let's say you do need to go out. I think it's very important that you frequent hand washing, just keeping yourself outside of 6 feet of other people as much as you can for periods of time, greater than 2 minutes. That's kind of one of the windows they've said early on, is if you're within someone, if you're close enough to someone that you're within 6 feet for more than 2 minutes, if they have an infection, there's a chance they could spread that to you. And so minimizing distance.
How does that happen? I mean, if you're 6 feet away, how is it transmitted? If you're talking to a person, he's only 3 feet away from you or two.
Well, it's transmitted through droplets. So if they cough a little bit on their hand, that's going to spread out in small little droplets that you have a chance to inhale. If they sneeze, or just even the mere breathing, you're breathing out little mist and little droplets all the time. And so it's not perfect. There's some studies that show when someone sneezes, that stuff can show up 30 feet away. But this virus is particularly sticky. It's a common cold as far as contagious is concerned. And so, and again, you've touched everything. So remember, you sneeze or cough, this stuff lays on a surface. You're going to pick that up. And what do we, I've never wanted to touch my face more than the last 2 weeks until I was told I shouldn't. You touch your eye, you rub your nose, you scratch your ear, you rub your mouth, and all of a sudden, that's how this is going to get in. And so that kind of harkens back to the frequent hand washing. And so I think that's the most important thing that we can do, is to limit these social interactions, frequent hand washing, and just be safe. Pretend that you're sick already. You're going to go out and spread that? No, you're going to want to stay home. And so as best we can, we need to do that.
People they have to shop, go into grocery stores. What should they do?
Well, again, make it quick, have your list, go in. I think everybody is kind of like mutually assured destruction when you walk into these places. Everybody's doing a fairly good job of of not sitting around talking. People are being quick. You'll see some people wearing gloves, which I think is okay as long as you know how to take gloves off correctly and you're not rubbing your face all day with the gloves on. You know, some people wear the same set of gloves all day, and they'll touch your eyes, they'll touch your face. They kind of ruined, you know, the whole point of wearing them. But you know, should you wear a mask when you go out? The only people that are really recommending wear masks are people that are sick, you know, right now. And in healthcare, we're using them more often.
1-888-402-LVHN. That's 1-888-402-5846, folks. Have any questions whatsoever. Once again, thank you, Phil Benyo Jr., and folks, stay healthy.
The American Red Cross urgently needs blood and platelet donations and asks all healthy donors to schedule an appointment to give now. With the coronavirus outbreak, it is important to maintain a sufficient blood supply. Your blood donation is critical and can help save lives. Please schedule an appointment today. Download the Blood Donor app, visit redcrossblood.org, or call 1-800-RED-CROSS today. You can make a difference.
It's the power of localism. Larger media companies don't have the pulse on what drives the country right now. They don't understand what's driving the concerns in the American communities, but you can get that through SSP TV because this is a platform for community engagement.